John Sculley is with us right now. He's the former CEO of Apple, currently the chairman of RxAdvance. John, good to see you. Thanks so much for joining us.
Thank you, Maria.
Yeah, we wanted to get your take on this because you're so involved in healthcare with RxAdvance. You say that the amount of money being wasted in healthcare is incredible. Tell us about that. And what is RxAdvance doing
Sure.
too?
Well, healthcare spends $3 trillion a year. It's estimated that $900 billion is wasted. And a lot of it is because there's no transparency into the cost of healthcare. We focus at RxAdvance at the most expensive part of the system, the 5% of the population who are chronically ill. That's $1.5 trillion of spend. Again, no transparency in terms of the drugs they're taking, typically 15 to 25 pills a day. And the physicians writing these scripts, they're competent, but they don't know what the other physicians are writing their prescriptions. And so there's a lot of duplication. There's side effects. You have to have drug adherence. People take their pills daily. None of this is being managed effectively.
Yeah, one of the biggest things I see is that employers can help fix the healthcare system, and one of the reasons they can do that is putting purchasing groups together, right? So you had 20 large employers get together, they've got a buying group of 4 million. They can negotiate the price of healthcare with that buying group. Do you see that as another way to help fix the system, and how can the government help assist that?
Well, I'm not really into the policy side of it. We are working with the state governors. I was just out with Governor John Kasich about 10 days ago, and he's faced, like many governors are, with the cost of Medicaid. Medicaid expansion sunsets in terms of those funds. Huge opioid problem, as Senator Brown was talking to you earlier about. So we're showing the governor, and we're doing this with other governors around the country, that there's the opportunity to save billions of dollars on Medicaid. The governors have the authority to actually get things done. And we think that's one of the places to go in and really focus. Take Medicaid and take literally billions of dollars of cost out of it by opening up transparency and giving ways to do things.
And that helps their budgets, right? So they're looking at it on their budget line.
They have to remember that most of them have to balance budgets.
Yeah. John, you talk about how private sector innovation and technology generally can do so much to help cut down on these healthcare costs. You know, what response are you seeing from politicians who are all, policy wonk and all, just thinking about the legislation? How do you really create and expand this influence of what you're doing so that people get it and it actually does help make these changes?
Well, it's a great question because the politicians are focused on things that politicians like to focus on, which is policy, it's subsidies, who pays for what, ideology. What hasn't been factored in yet, Kristen, is why can't we deliver health care at a much lower cost? Why can't we take the same advances in cloud computing, data analytics, machine learning, and develop process automation to be able to go in and look at the entire care continuum?
So what's the answer then? Because, I mean, you speak with, Heather Bresch for the CEO of Mylan Labs, and she says it's the pharmacy benefit managers as part of the structure. That's also part of the reason that prices are as high as they are. So she's saying, look, yeah, we raised the price of the EpiPen, but let's not forget I have to give a portion to the pharmacy benefit managers. Is that true at RxAdvance?
Well, she's absolutely correct that the pharmacy benefit management industry is running on technology that was designed 25 years ago, AS400, large mainframe type computers, COBOL computing, green screens, things that haven't adapted to the world that we have today with cloud computing. And so, there are huge opportunities for the pharmacy benefit management industry to say, let's catch up and do things other industries are doing. But why hasn't it happened? Because healthcare is so complex with thousands of rules and special interests and things of that sort. So what we did at RxAdvance, we've had 16 years of experience building companies. And so our team understands the complexity of healthcare, but they're also experts in process automation and machine learning.
But until you change the way that Americans receive their health insurance, you have the vast majority of people get their health insurance through their company, and there is no price transparency at all. And people are essentially encouraged to consume the most amount of health care, even if they don't need it. And that's one of the things, not just with drugs, but just the health care in general, that drives up prices. prices, and there's no movement at all in Washington to change that.
Dagan, you are so right. And just imagine what Jeff Bezos would do. I just read his letter to his shareholders, terrific letter if you haven't read it. And what he talks about is you've got to focus on the customer. In this case, it's the patient or the person owning the health plan. You've got to have transparency. We know how to do that with technology. And you can relook at the entire system in terms of costs, and we, the industry, can dramatically reduce the cost of delivery. This industry can be disrupted as much as e-commerce has, telecommunications, fintech, all these other industries are doing this. Why hasn't it happened in healthcare?
Well, but also, though, Amazon doesn't have the same sort of handcuffs on it, than a healthcare provider would or a healthcare company would, because they're not regulated the way that the FDA regulates healthcare. So Jeff Bezos has been incredibly, successful, and he's incredibly innovative, and I agree on the shareholders letter. But is it apples to apples? Because you're talking about one highly regulated industry versus retail, which is very different. It's a great point, Maria, because after I left Apple, I went into regulated industries. I went into telecommunications when we built Metro PCS. I've been in fintech, which I'm also involved with. I'm in healthcare. These are all regulated industries. High tech tends to steer clear of regulated industries because they're complex. They're easier places to go. Too many bureaucracies.
And their money suck.
Yeah, and so now we've got to say, let's have the patience to learn the complexity of these regulated industries. Believe me, there is huge opportunities in regulated industries, but you got to learn the rules. Thousands of protocols and precedents and issues you have to deal with, which you don't see in non-regulated industries. Will the policy come out of Washington help in this? The rollback of regs? I think there's some good moves that Washington can make, but the reality is what is being proposed by both Democrats and Republicans isn't a solve of the problem that the president has set the aspirations for. He says, I want to cover everybody with a better quality health insurance. The Republican plan basically takes $1 trillion out over 10 years, and there'll be fewer people covered. The Democrats don't have a plan. And why not shift the focus to what the real way to solve it, which is to go in and say, wait a minute, we can deliver health care in a much less expensive way. And companies like RxAdvance, we won't be the only one. There'll be other companies, but you got to have role models of people who do it. And when you get a role model, other people follow. John, we're glad that you're working on this, that's for sure. John Sculley joining us there. Thank you so much, sir.